This week, for the first time, an influential health panel recommended anxiety screenings for all adults under 65, even if a person doesn't show signs of anxiety. Joining us to discuss this, we bring in our 9 News health expert, Dr. Payal Kohli. Hey, Dr. Kohli, thanks for joining us.
My pleasure.
So why is this type of screening important?
Erica, it's changing the landscape of how we think about mental health and mental conditions in the United States. The first time the U.S. Preventive Services Task Force, which is, tasked with looking at preventing the biggest diseases that impact our population, is saying anxiety matters, mental health matters, it's underdiagnosed, and it can actually affect anyone, regardless of, their income status, their gender, their race. Everybody should be looking for it.
Is this something since the pandemic, like so many people, I feel like, have anxiety now, like it scared so many people. Are we seeing this because of that?
Partly, yes.
Yeah.
And I think that's one of the silver linings of this pandemic, is that so many of us developed anxiety disorders during the pandemic. The latest data tells us that, 1 in 5 Americans is living with an anxiety disorder. Our younger population is now the most likely to seek treatment for anxiety disorders. And so the pandemic, I think, kind of ushered in the notion that we need to wake up, pay attention, and really start thinking about anxiety as a public health problem.
Absolutely. Okay, so we were just chatting about this a little bit, of potentially a myth here that if you have on record that you have anxiety, that it could impact your life insurance.
Yeah, so a lot of people worry about that. And I was just saying, as a doctor, a lot of my colleagues worry about the fact that if they see a mental health professional, it could go in their record and be something that gets counted against them when it comes time to apply for a license or such. And I think we're really moving away from that. And I think part of putting this into the universal screening has embraced that notion that not only do we need to accept mental health conditions just as we do physical health conditions like hypertension or diabetes, but we also need to start diagnosing them early and treating them early, because so many people suppress or repress their conditions because they're worried about getting diagnosed with this, and we need to normalize this discussion.
Absolutely. So how does this universal screening work for anxiety? Like you schedule your yearly with your PCP and we're going from there. How would it kind of look?
Yeah, pretty much. I mean, so when you're sitting in your doctor's office, we aren't just asking you about heart disease or your diet habits, your smoking, your alcohol. We're also asking you about anxiety. And really the way to tell a difference between normal versus abnormal anxiety is if it starts to interfere with your functioning. Okay. If the volume of it is turned really high up. In other words, it's really sort of impairing the way that you work on a day-to-day basis. And it's your doctor's job, I think, to start to bring some of that out, but it's also our job to start looking in ourselves and our family members, start to see if somebody is behaving in a way because of their anxiety that affects their day-to-day life. They may have an undiagnosed anxiety disorder.
Yeah, and for that, potentially prescribing something for it, which you can maybe use as needed or maybe every day, right?
Well, there are so many options for treatment, and that's the lovely thing here. So you can do cognitive behavioral therapy, which is sort of restructuring your thoughts. That's very effective, and that works with longevity in the long term. You can talk about talk therapy, which is, talking to a therapist and kind of helping in the acute situation. You can do acupuncture. That's had a lot of benefits with anxiety. And then, of course, there's the prescription medications as well that can certainly help individuals.
As always, Dr. Kohli, thank you so much for joining us.